I'd talk about the change in the welfare state. What it used to do and what it's doing today is quite different, and that also comes with a cost. Just one example on that, health-related benefits have increased close to 50% in the 5 years that followed the start of the pandemic.
Well, the BBC's Politics Live is back, bringing with it the return of simplistic, ideologically loaded narratives about the welfare state without serious regard for facts or nuance. I'm Mike from Vox Political. Buy me a coffee because my throat is going to get dry, and let's dive in. Yes, the number of people receiving health-related benefits, particularly personal independence payment and incapacity-related employment and support allowance, or universal credit, has increased substantially since 2020, close to 50% in 5 years. According to the Department for Work and Pensions, 3.5 million people were receiving PIP in early 2024, up from around 2.2 million in 2020. The number of working-age adults classed as economically inactive due to long-term sickness is now more than 2.8 million, a post-war record. Why? Long COVID and delayed NHS treatment have led to worsening health. Mental health conditions, especially among younger people, have risen dramatically. NHS backlogs mean people are becoming sicker before they receive help. Rising retirement age means more people are now too ill to work at 64 to 66 than they were when retirement age was 60 or 65. So the bottom line is the rise is real, but it's driven by worsening health, not malingering, and many of these people want to work but can't due to systemic failures in both healthcare and work accessibility. Thanks, Tories.
We need to drastically reduce our welfare bill. The welfare state has expanded far beyond its original purpose of providing a safety net to the most vulnerable. Now, over half of people in Britain today are net recipients from the state. This is simply unsustainable. And as Ross says, we do have worsening demographics. Our worker to grey ratio is going down and down. There will be fewer people who are able to support the welfare state, who are able to support the NHS going forward.
Yes, in recent analyses, around 53% of UK households receive more in cash benefits in public services than they pay in taxes. This includes pensions, schools, NHS care and disability benefits. But this is normal in any functioning welfare state. What it includes is retired people receiving pensions. This is the largest component. Children receiving education or child benefit. Disabled people, carers and working families on low incomes, and anyone using the NHS. Look, in 2019 to 20, 85% of income tax was paid by the top 50% of earners, which is typical for progressive tax systems. These transfers stabilise the economy, prevent poverty and support demand. The UK spends a lower share of GDP on welfare than many comparable European countries. For example, France, Germany, Denmark. And the bottom line here is that the net recipient framing ignores that most people both receive and contribute at different life stages. The idea that this is unsustainable is ideological, not factual. Yes, the UK has an ageing population. The dependency ratio, non-working versus working population, is rising. But productivity gains, immigration, as Andrew Fisher stated, only to be shouted down, and automation can support a stable welfare state, even with fewer workers per retiree. Other countries with older populations, Japan, Germany, still sustain robust welfare states through higher taxes, smarter spending, and economic planning. Raising the retirement age, as Labour supports, shifts the problem. Older workers are now more likely to fall ill, but not yet entitled to pensions. So the bottom line here is that the ageing population is a challenge, not a crisis. It requires reform, but not abandonment of the welfare state.
On welfare, where do you stand on that? Do you think we should be reducing the welfare budget? That is forecast to rise an awful lot, isn't it?
I agree, we don't have a choice.
How do you do that? That's always the question, isn't it?
For me, it is about enabling people back into work. It's working with employers so that there can be adjustments in the workplace. So there's also changing the law, so there's a right to try, so people can be eased into work. And we need to ensure that people are putting a wage on the table, because I think that actually lifts aspirations and raises opportunities and creates that change in communities where poverty is extremely low, far too low. And so for me, I think the government is taking the right step. Those people who are long-term ill or never work because of their disability have to be protected within that system, but the focus has to be on people committing and contributing.
Work can be good for people's health, dignity and income if they are actually able to work. But many people on disability or sickness benefits are already in work, especially under universal credit. Others face real barriers: inaccessible workplaces, inflexible employers, health conditions or caring responsibilities. Labour's own reforms, including tightening work capability assessments, actually risk removing support from people deemed fit for work despite having serious limitations. The bottom line here is that talking about work is politically safe, but the real issue is the quality of jobs, accessibility and support, not just moving people off benefits. Yes, health-related benefit claims have risen because public health has declined. Long COVID, NHS delays and mental health pressures have created a real increase in need. More than half the population being net recipients isn't a crisis, it's how modern societies work. Pensions, healthcare and education are essential services, not handouts. Demographics don't doom the welfare state, but they do require honest debate about how to fund it fairly via taxation, not austerity. Labour's work rhetoric ignores the reality that many recipients of welfare already work or can't work. Removing support won't make people healthier, it will make them poorer. If Labour doesn't rethink its approach, it risks reinforcing conservative framing while leaving vulnerable people worse off. I've been Mike Sevier of Vox Political, and if you found this useful, or if you believe in independent political journalism, help me keep it going. Donate £20 or more, and I'll send you a signed copy of my book, Strong Words in Hard Times. See, it does exist. Links below. Thank you for watching, and you'll see me in the next one.